Okay, it's 11 o'clock, Bree. Can you tell if all seven of the trustees are on? Or better yet, why don't you call a roll of the trustees, please?
All right, Tamar Alexander,
Good morning, everyone present.
Commissioner Kevin Boozle, okay, I'll come back to Kevin. Aaron Dalton,
I'm here.
Shay Madden,
Here.
Commissioner Robert Postal,
Here.
Senator Christine Tartaglione,
Here.
Chair Tom Van Kirk,
Here.
all right, and Commissioner Kevin Boozle.
Here.
Okay, with all trustees being present, we will call to order the this meeting of the Pennsylvania Abatement Trust Dispute Resolution Committee. This has been duly advertised as a public meeting in accordance with the Sunshine Act and is open to members of the public as observers. And I do see a fair number of members of the public that are participating. Participation in the meeting is going to be limited to representatives of Erie County, Dauphin County, and Chester County. And we will only allow participation for each of those three counties when their dispute is being heard. Otherwise, they're free to stay on the phone, but they will not be allowed to participate in the meeting unless it is an appeal that they are presenting. The meeting is being recorded, and minutes from the meeting will be available on the Trust website after they are approved. And I would like to say that an executive session was held today immediately prior to the public meeting for purposes of receiving legal updates and legal advice. And we did have a discussion as to how we were going to proceed. What we agreed upon is, and the way we are going to proceed is we will hear the appeals from Erie County, both their program number 9, which is opioid use disorder library collections, and an appeal regarding certified recovery specialist services. We will then ask the people from Erie to mute. As I said, they can still participate in the meeting, or they can still observe the meeting. They will not be able to participate, and we will hear the appeal from Chester County regarding their program involving equestrian recovery supports. We will then ask the people from Chester to no longer participate, although they can observe, and we'll hear the appeal from Dauphin County regarding their Renew program. Is there any questions as to how we're going to be proceeding? Okay, could the representatives from Erie County who are going to be presenting the 2 Erie County appeals, could you please identify yourself, state your name and your position with Erie?
Hey, Tom,
Yes.
can we do the review the minutes from the?
Yeah, we most certainly can. We did circulate the minutes of the meeting, and I would ask whether or not there's any additions or corrections to the minutes that were circulated, and that is the meeting of the September 5th, which is the one where we heard the appeal from Somerset County. Sir, any additions or corrections? Can I have a motion the minutes be approved?
Motion to approve. Second. It's postal.
Okay, all in favor, please say aye.
Aye.
Opposed? Okay. Now, could we have the people from Erie who are presenting the appeal, please identify yourself for the record.
Morning, everyone. Thank you for taking the time. I am Scott Cohenauer, the Director of Erie County Office of Drug and Alcohol Abuse, so the Director for the SCA here in Erie.
John DiMatteo, Director of Human Services for Erie County.
Richard Gold, Consultant to Erie County Department of Human Services.
Lana Reese, the Deputy Director of the Department of Human Services.
I'm sorry, I didn't hear your name. I apologize.
Lana Reese,
Gotcha.
thank you.
Thank you, Lana. Anybody else from here? Okay, you have a half hour to present your appeal, which will include any questions that we may have. And please state, and we'll start with the OUD library collections and go from there. So whoever would like to take the lead.
Okay, I'd like to have John DiMatteo just spend some time familiarizing everybody with what our process here is in Erie County in regard to local oversight of our opioid settlement funds. Some background information on how we established that local oversight committee, and some of the processes and procedures and protocols that we established locally. So John, if you don't mind.
Sure, thanks, Scott. Members of the committee, thank you for taking the time to talk with us this morning. Wanted to give you a bit of background on our Erie County process. And when the opioid settlements were seen to be sort of it's going to happen, they were going to come through, we took some time locally to talk about what would make the most sense for us in local government to manage a process that would have many years, 17, 18, sometimes it may end up being more years than that, and how we would manage that in a local government. And so we really wanted to have a flavor for what happens as in need here locally. Even when we talked with the current governor back when he was the Attorney General, he talked about what would this settlement look like in a local basis. And he came here to Erie and we talked very specifically about some of the issues that we were seeing here. And so in order to do that, we spent a bit of time talking to our county executive. We have a home rule charter here. So we have a county executive and a county council as to what that might look like. And so we presented to both the administration and to our county council a process that would put into place what we've called the Erie County Opioid Settlement Fund Local Oversight Committee. And so what we did is we tried to bring together people who work in county government by position, not by person, so that we could take a look over really a period of many years that would be in place for future generation here in Erie County. And so as we met, we talked about who would be the rightful members of that committee. We looked at somebody who would be the director of drug and alcohol abuse or their designee, the chairperson of county council or somebody that they would assign to that particular committee, the director of human services, the county executive or the director of administration or their designee, the director of the health department, the director of our drug and alcohol advisory board. And I think that is it. I think we had 7. So we had 7 persons who we had put on this committee. It seemed to make the most sense for us to be able to have insight from lots of different places. After several meetings with both the council and with the administration, they both were in agreement for us to get that set up. And in early 2022, we set forth on that committee to move things forward as to how we would review, view, and put these things together. So prior to the use of any of those funds, we wanted to make sure that we had this in our space, that we'd have a line within our SCA's budget so that the money would go through there, so we would not be taking up an exorbitant amount of administrative time, going to council meetings, et cetera, every time that there would be an expenditure. So it made good sense. From that point, we started to meet as an administrative committee. We met, put together some bylaws, which I know that Dr. Kohenauer has shared with you as part of this submission. And we could add those to additional information if they are not as part of this 244-page packet. So all in all, I wanted you to be able to understand where we were, how we got here, and that we do take this role seriously, and that we are, again, open to your feedback. Thank you.
And John, this is Tom Van Kirk. I would say I appreciate everything Erie County did do to convene, get input, etc. I think it's important. I think the counties that did do it, as you did, Bucks County comes to mind, were very, very well served. And indeed, I think that Erie was very well served. You submitted 13 for approval. 11 were approved. And you did receive $2.8 million. And I do think that you are seeking input as to how to best address it. So you understand our role. Our role is not to say whether or not we would have spent the money the same way. The reason that the Attorney General's office and indeed CCAP and others that were involved in the process of how would the money be distributed, the reason it was distributed, much of it to the local level, about 85%, was because each county's individual needs are going to be different. So we are not here to try to make sure it's all uniform and that everybody spends the money on the same thing. We would like to hope that we can provide oversight that would provide some continuity, that if one county wasn't permitted to do something, another county would also not be permitted to spend it on that type of thing, okay? So I think you're very well served, and I think I commend Erie for approaching it and getting the input you did. I do have two questions in that regard. Number one, after there are the recommendations of the group that you just described, do the county commissioners or does the county executive have a session and approve the recommendations of the group that you just described?
County Council and the County Executive's Office both have representatives on this committee, so there is not a separate meeting, although the County Executive does sign off on all of our contracts as they go out. So I'm not sure if that answers your question, but that's...
No, it does. So there is the approval process that is needed insofar as the county executive has to sign the contracts. But for the most part, although they have representatives, it is your group that makes it is the group you just described that makes the recommendations and makes the decision subject to the county executive actually signing the contracts.
That's correct. There is an additional step, I think, that we had employed in the first two rounds of taking a look at projects in which we asked for submissions, and there was even a subgroup that did some review and scoring that they made recommendation to our oversight group.
Okay. And is that done in a public meeting?
The meetings have been public, yes. We have had.
Okay, thank you. Okay, because one thing we are striving for is to make sure that with the decisions being made at the local level, at the county level, and we do agree the public should have an opportunity for input, but it should be at the level where it's being spent, which is the level you're just describing, and not at the trust level where we're merely saying whether or not we believe it complies with Exhibit E. So I just wanted to make that clear, okay?
Thank you.
So thank you. My second question is, if we're moving on to the library collections, I wanted to make sure that we're dealing with the right numbers. Am I correct that you are seeking approval for a total of $23,000 for the OUD library collections, which is $5,000 that was spent as of March 15th, and an additional $17,000 that is going to be spent and may have already been spent going forward in the future?
Yes, that is correct.
Okay, so it's a total of $23,000 that we are dealing with. And as you put in your submission, it appears that although the first part of the submission that you made in March dealt primarily with the OUD library collections and the actual purchase of books for the library, that a second part of it that has developed over the course of time is various presentations that are being made. I think you refer to them as educational seminars. Two questions with that regard. Are the presentations that are being made, are they being done by library personnel?
They're being coordinated by library personnel, county personnel, but we have guest speakers, professionals in the field at each of those events. So experts in the field locally and regionally that really run the presentations. The facilitation is county personnel, library personnel, but we didn't use any funds to fund any percentage of county personnel to put on those activities.
Okay, and as between the two, the library collections, number one, and the presentations, number two, what is the approximate allocation of the 23,000 between those two separate functions?
I believe the books totaled, I'd have to look at that number, sir. I believe the books totaled approximately 5,000, and then the remaining project allocation would be for those public interfacing initiatives, educational forums that we put on. I can double check that before we conclude here though, but I believe it was 5,000 for the reading materials, the books and such.
Okay, and then one final question, if you don't mind, before I get started, just for context, when you talk about the Erie County Public Library, how many different libraries fall within that? And are local municipalities' libraries included within the Erie County Public Library? Or do you have a county library system and then a separate, do individual municipalities have their own separate libraries that might be separately funded?
We have several different library locations, and we spread this programming out throughout the county. So different library locations. We have a main Erie City library location, which is really the main location of our library. But then other municipalities within Erie County were afforded the opportunity to present these educational forums to their constituents and their local residents at those satellite offices.
Those are county-run libraries, though.
Yeah,
County
absolutely.
run library.
Just to be, I think that was your question.
That was really my question, yes.
Yep.
Okay. Okay, with that, the floor is yours.
So like Mr. DiMatteo had spoken of, we submitted quite a bit of documentation with these appeals. But I guess I'd like to focus on the information we received in regards to why the project was denied and why we're here on the appeal. So from my understanding, the request was denied for failing to establish any connection regarding those with OUD and or at risk of developing OUD. I guess I just wanted to clarify that the main goals of this project were to educate the public on opioid use disorder, opioid and fentanyl related overdose trends, and also the proper utilization of Narcan products in order to really address the opioid crisis and opioid overdoses here in Erie County and to save lives at the end of the day, to spread the word on what we're seeing in the street, which is a very high percentage of fentanyl contained in our illicit drug market here in Erie County. Overdose trends in Erie County over the last couple years, overdose deaths have involved over 85% of fentanyl lacings with all the illicit drugs that we have here in Erie County. So we wanted to address that in a public forum. And actually the book materials that we did purchase for the library also speak to the main goals and priorities of this project, really, is to educate the public on the risks of overdoses, specifically fentanyl-induced overdoses that we're experiencing at a very high rate here in Erie County. And we feel that the project was very successful in doing so and reaching different communities, different persons, different members of the community here in Erie County. We feel like it was a very successful program, especially for the cost of the program. We're speaking of $22,000. We felt like we reached a great deal of individuals that we would not have been able to reach were it not for the opioid settlement funds. And in that regard, we felt like it was a huge success and something that would absolutely not have happened if we were not afforded the opportunity to utilize these opioid settlement funds. In regard to specifically to how this aligns with Exhibit E, that is in the documents that I submitted, but specifically Schedule B, Part 2, Prevention, Section G is where we're really going to discuss how this project really aligns with Exhibit E priorities, right? So that would be corrective advertising or affirmative public education campaigns based on evidence, public education relating to drug disposal, which was a big part of this initiative, funding community anti-drug coalitions that engage in drug prevention efforts, which these did address, and creating or supporting community-based education or intervention services for family use and adolescents at risk for OUD or any co-occurring SUD, MH conditions, which exists throughout Erie County. And that's really surmised by our overdose trends that we're currently experiencing here in Erie County. We got a big problem here in Erie County, and we're looking at every project, every initiative, every idea in order to address that problem. And I feel like this project firmly aligns with some of our other current initiatives, such as the Regional Recovery Hub, where our main goal is to serve the community, to connect individuals that are currently disconnected, whether that be with information or with treatment or recovery. And I feel like this project did that in every regard. That's really all I had to say about this project. Sorry, my phone won't stop ringing. I feel like it was a pretty straightforward project as far as the mission and the goals of this project. And I would definitely welcome any further questions or would like to answer any further concerns that the committee might have, that the trust might have, really.
If I may, Mr. Chair, this is Kevin Boozle, Butler County.
Certainly.
Thank you. I just a couple of questions, sir, and I think that you hit on many of them. I understand the books and I understand the education. Would that prevention services that you're alluding to through this educational program, is that funded through other sources as well, or is this, because I see this is 100% funded from OUD, from the trust? Or do you have other prevention programs that are similar to this? Is there a reason you can't combine the two? That's number one. Number two is, well, go ahead and answer that first.
We do have many prevention programs through the SCA, sir, yeah.
And so one of the things that I look for is sustainability. So that's my question there, is the sustainability of this program only on the OUD fund, and what do you do beyond that? Any comment?
We're looking really for the opioid settlement funds in Erie County. It's definitely been a learning curve, right? So for the last 2 years, for ourselves here in Erie County and probably for members of the trust and for the state in general. In Erie County, we're currently spending $35 to $37 million in DNA services. Our estimated allocation of opioid settlement funds, wave one, is approximately $850,000 across those 18 years, right? Some more in current years, some less in future years. But our goals here is really to fill the gaps in the services that we have identified here in Erie County. And that's one of the things I want to hit on in the next appeal. As part of our grant, DDAP grant for the Regional Recovery Hub, we've really brought in as many stakeholders, as many experts, as many clinicians as we can to identify what those gaps are, right? And one of them being public education and messaging around the risks inherent to overdose here in Erie County. We are finding fentanyl in marijuana. We are finding fentanyl in fake pills. We are finding fentanyl in every illicit substance here in Erie County. And just that message alone, it's really surprising to me because we've had many projects where we address those concerns, and yet still I talk to people on a daily, weekly basis that do not realize that if you buy illicit drugs on the street, you are taking a very high risk of dying immediately from
Mhm.
fentanyl overdose. And so to me, the more projects that we can do, the more public facing initiatives that we can possibly pull off is going to save lives. And I don't know, sir, Mr. Buzo, I know we had talked on the
Yeah.
opioid leadership network that we're, you know, participants in nationally, as far as, you know, some of the other states and what their projects are.
Yep.
But that really is the goal here, is to fill the gaps that currently exist with the monies that we are afforded. We are not going to be able to change the system,
Right.
or improve the system overall. We're going to target the gaps in services and the transitions in services that we've currently identified here in Erie. And we have a very robust, in-depth, comprehensive project and initiative and capability in order to identify what those are. And that's once again referring to the regional recovery hub process, the needs assessment, that prioritization list. These are the projects that we align those opioid settlement funds with, is filling those transitions, because that's where we lose people, sir, is in the
Mhm.
transitions and the lack of education. And specifically what this library project did was address the lack of education to the general public and focus on Narcan availability. We ran a project funded by the SCA to saturate our community with Narcan. We did Narcan cabinets, all in alignment with this project. And we have Narcan cabinets readily available at many shelters now, a coordinated project. Tangential to this initiative, we have them at shelters, we have them at the library, we have them at Erie County offices, where 6 or 8 months ago, we did not have those. And we felt it was necessary to educate the public on what Narcan is. Some people don't realize what Narcan is or how to use it, or that it's available free at many, many locations now here in Erie County. So this is all part of a coordinated effort, really. And once again, we felt like it was very successful and continues to be such.
You hit my second question, which was your collaboration connection with the others. And I think the library breaks that stigma. The Narcan being available at the library as well. I did have a question, and this is just a personal reference of disposal drop boxes for old medications. Is it a tie-in with that? Along with fentanyl strips, but I didn't hear you mention fentanyl strips made available to anyone. So those are my three questions, but I think that I'll conclude with that. I'll let you finish with a statement. Thank you.
Yeah, we absolutely align all of our harm reduction products that we offer here at the SCA with every initiative that we do, to include this library project. Absolutely. To include fentanyl testing strips, xylazine testing strip, Narcan products, educational material, lock boxes, timer cap, locks. I hope that answered your question, sir.
Other questions? Scott, I have just one or two. Looking at this, I look, for example, one of the things we've asked people is, does it address opioid, or are you using it to address a number of different ills? Okay. So in the materials you submitted on your opioid education series that you are applying for, which presumably you have $17,000 going to, one of the programs was Write Your Reps. Let your voice be heard. Join the League of Women Voters for tips on how to write to your how to write your elected officials. Whether you want to become more politically engaged or you're already passionate, the League of Women Voters will offer tips and tricks to help your letters stand out from the crowd. My question, what does that have to do with the opioid epidemic?
I think really that was one small component to this entire project, to this whole project. And I do understand your concerns. I think that was an attempt to get people actively involved and engaged in what's happening in our community, and to better be able to understand and address how politicians are involved in this equation, and they are making decisions that affect Erie here locally. And once again, to me, that was one small component of this entire project, was that one event, that one forum. The other forums, I can go over them here, sir, if you'd like.
No, I've read the other ones. I do have a question about one of them. I've read The Empire of Pain. Excellent book, and really talks about how this problem originated, what the cause of it was, etc. It does not deal in any way with treating the opioid epidemic. It does point out a lot of good reasons why the Sacklers ought to be in jail, I will admit, and why they ought to ante up, and Purdue Pharmacy ought to be paying their fair share of these settlements. But it really doesn't have anything to do with overcoming the opioid epidemic. Yet that is one of the programs that you have here, is really a book club. So my question really is, and what we went back to ask you from the very beginning, is how much of this is really directed to the opioid epidemic, and does it go to education? For example, I think you said with regard to the books that were purchased, which is about $5,000 worth of books, that during whatever period of time you originally submitted, they were checked out 124 times. Do you really think 124 checkouts of more than 25 books is really educating the public as to all of these matters that you want to educate them on? I'm not against libraries. I'm not against the presentations. I'm really asking whether or not this is educating the public in the manner in which you want to educate them.
I absolutely sincerely think that every little bit helps, sir. I really do. And the numbers that you're referencing were early in this project. I believe those were the first couple months of the project. We can provide you with more current numbers in regards to how many times those books have been checked out. I would anticipate they were much greater than the 100 sometimes that you're quoting. That was very early reporting in this project. I could definitely provide those numbers for you, though.
Okay, and the other, well, part and parcel of that question is the Exhibit E sections that you cited as the reason why these projects should be approved. They all require it to be evidence-based or evidence-informed. Is this true of either of those? Are these programs, is buying library books and putting them in a public library, is that something that is evidence-based or evidence-informed?
Not that I'm aware of, sir.
Thank you. Okay. Thank you. Anybody else now have any questions?
I do. Under section G, 10, it suggests that the community-based education must target for people at risk for OUD. I didn't see an argument made by the county that this program is targeted to those at risk.
You're accurate, Senator, in your statement that this did not target a specific population. It was a more general education campaign, which we felt was necessary and appropriate, given the issues we have here in Erie County. Once again, this year, we were the highest county in the state for overdoses per capita. So to me, everybody in Erie County is at risk of overdose. If you look at our numbers, it speaks to that. If you look at our overdose trends, it speaks to that. Unfortunately, regardless of how old or how young you are at risk if you're an Erie County resident of an overdose, specifically involving fentanyl. Ms. Lana Reese can speak to that as well. We've seen infants contact overdoses of fentanyl laced products all the way up to persons in their high 60s. So I believe, based on our numbers and our trends and the current crisis we're experiencing, everybody is at risk here in Erie County currently, unfortunately.
So you specifically did not go out and target at risk. Okay. That was G10, and I think the chairman was talking about G8, which is the evidence-based or evidence-informed. And that was also no, correct?
Yeah, we did not align this initiative. It was more of a public media, but that's actually covered in other sections in Exhibit E. I would have to look through Exhibit E here to see exactly where that's covered. But media campaigns and educational programs are also covered in Exhibit E. And they don't reference evidence-based or evidence-informed terminology or requirements. So I am aware of many other counties utilizing those components of Exhibit E to put on public media, public education, general forums that don't specifically target a subset of the population.
Okay.
I have just a quick question. This is Commissioner Postal. And your series is just about over. If it isn't, I think it ended in perhaps August. And I think it goes to the sustainability question that the commissioner brought up earlier. So how do you plan next year's, if you are planning next year's? Because is it through the committee that you have established? Or will it be?
To be very honest, sir, our current protocols in area are being looked at very closely because of the current appeals that we're undertaking. We do not have a clear direction on what projects will look like moving forward. And once again, the primary reason is because of our projects being deemed non-compliant. So for example, we did have 15 projects scheduled for 24-25. We have suspended those projects until we figure out exactly with clarification how to best proceed. One of the big problems, and we can discuss this in this appeal or the next appeal, is these monies have already been spent. We do not currently have a mechanism to pay back those monies. And that's a big problem, budgetarily speaking. I don't know if Patrick Ryan, our fiscal manager for DHS, is on the call, Lana, but due to those concerns and other current concerns, and really to the need for a little bit more clarity on how to proceed, we've currently suspended those projects that we had planned for 24-25 with great regret. But that's
Scott,
where we are, and we have to get through this appeal before we can have those discussions on what future projects and what future processes might look like. And to be honest, it's a tragedy, really, that we had to suspend these projects because we don't have the clarity that we need and the political support that we absolutely need to move forward, because we don't have answers for finding money for programs that we already spent with opioid settlement funds.
Scott, I would say that to the extent that you're not aware, you should be, because this has been presented at a number of CCAP meetings and others. We do have a procedure. It's called the Technical Advisory Group, where you can present questions as to whether or not we believe something is going to be approved and falls within Exhibit E. The Technical Advisory Group looks at it. Here's what your questions are, renders its opinion. It then goes to all the trustees. The trustees weigh in on it, and you can get assurance from that as to whether the trust views it to be appropriate. So there really is no reason why you ought to be suspending all of them until you hear about these appeals. This has been in process since May of 2023. We have issued a number of advisory opinions. A number of counties have availed themselves of that, and I would urge Erie to follow that mechanism rather than just suspend, because I agree, it's tragic if you're not spending money, because we do have a procedure to be addressing exactly your concerns.
I appreciate that, Mr. Van Kirk, and that is our intention. When I talk about suspending, that is our intention, to run our projects through the PA Trust for a pre-approval of sorts, if you will. And I was made aware of that in either May or June of this year. So that would be the process. Once again, there's some delays in getting the committee members here locally convened to approve what those protocols and processes might look like. But that is absolutely our intention.
Good.
To rely on that opportunity that you're providing us for input before we move forward with projects. And that's, so I should have clarified, that is our intention, is to utilize that opportunity to get the pre-approval, for lack of a better term, before we move forward with these projects. So we can avoid these sorts of issues in the future. That's really what we want to do here is operate in a team-oriented approach and manner and figure out and also admit, like I did earlier, that this is new to us, and I think it's new to most of the members of the trust, and we're trying to determine how best to proceed. And once again, I do appreciate that opportunity. It'll be very vital in our processes moving forward, is to rely on your guidance and technical assistance in order to get that pre-approval that we need to get the support that we need from the upper echelon decision makers here in Erie County. If that makes sense, sir.
No, it makes sense, and it is very important. And really, this has been in place since May of 2023, and it has been pretty well publicized that it is. A lot of people themselves available of it, and the committees, just so you know, the technical advisory group meets every other week, Thursday morning at 10 o'clock, in order to consider it. And what they recommend immediately goes out to the trust, so we can get answers, not always within a month period of time or even a month and a half, but it doesn't have to await just the reporting periods and that. I just wanted to make sure you were aware of that, and hopefully you will avail yourself of that, Scott.
We did take you up on that opportunity, sir. We did get a halfway house expansion project pre-approved
Great.
By the trust.
Excellent.
A few months ago, and really, like I said, that will be our standard operating procedure moving forward.
Good.
Excuse me, we have reached the 30-minute threshold at 11:39. So if we're able to pivot to their program number 11, that would be advisable.
Okay. I would like to have anybody answer any other questions they want to. Some of these, Bree, have dealt with what will come up under both of these, so I don't feel overly bad going over if anybody has any other questions. But thank you for being our timekeeper on this. I appreciate it.
Let me switch gears here. Just give me one.
Okay. And we're going to move on to the Certified Recovery Specialist Services. And my first question in that regard, Scott, or anybody else from Erie, is that $150,000 that you're asking for on this program?
That would be the maximum cost, sir. So it's an expense contract. So if up to $150,000 of those CRS services are expensed, then that's what we would reimburse on a maximum basis.
And you mentioned money has already been spent. I recognize that for library services. How much of the 150 has already been spent?
I don't have an exact number. It took some time to get that program off the ground, just because we do have a shortage of certified recovery specialists here in Erie. We kind of coordinated this program with some enhanced outreach to increase the certified recovery specialist pool of candidates here in Erie. So it took us several months to get this off the ground. If I had to estimate, we're probably looking at about $50,000 of the $150,000 that has been expensed on that project. We have 2 full-time CRS individuals with lived experience, currently in recovery, currently certified at this facility full-time. So the agency, the facility expenses those costs to us on a monthly basis, and then we reimburse. I can get you that exact number, but last time I checked, it was nearing about $50,000. I
Okay.
can get you the exact number if you would like.
No, I just wanted to know approximately where we're at. Thank you. Okay. So you can go ahead and proceed with your presentation.
Okay, great. Give me 1 second, sorry.
No problem. Any,
While you're doing that, this is Commissioner Postal, just real quick, is Cadenzia a 501c3 nonprofit?
Yes,
Okay,
they
thanks.
are a nonprofit.
Well, I know they're nonprofit. Is it 501c3?
Yes. Okay, so to start this off, to start the discussion off, I would like to reference, I'm sorry, I lost my place here a little bit. I got papers kind of spread everywhere. But I'd like to reference and focus on, first of all, the Regional Recovery Hub activities, a grant that was afforded by the Department of Drug and Alcohol Program. It's a project that's been ongoing for about a year now. What that afforded us to do was do an in-depth, robust needs assessment of the recovery services here in Erie County and develop a strategic plan. As part of that strategic plan, which the information I did submit with this appeal, CRS expansion and enhancement of CRS services was within the top 7 priorities in that prioritized strategic plan. And like I had spoken before, we've combined this CRS expansion project with other initiatives. We did some contingency management opportunities to recruit certified recovery specialists to not only get the training, but also to follow through with certification and then to also follow through with employment. So we've been able to do that as well. And we have increased CRS capacity and CRS staffing and certified recovery specialists in that candidate pool here in Erie County. We've done that as a direct result of the ability to utilize these opioid settlement funds and to align some of these projects and coordinate them with that overall needs assessment that I had provided with the original appeal documentation and the strategic plan that we have in place for Erie. We feel that peer support services are very, very critical and that we do have a current deficit in capacity here in Erie County, and we're addressing that. And this is one component to that, is expanding those services. So speaking specifically in regard to Exhibit E, I would like to reference how we feel like this aligned with Exhibit E. It would be Schedule B, Part 1 treatment, A, number 5. B, support people in treatment and recovery, number 2. C, connect people who need help to the help they need, connections to care, numbers 10 and 11. And I can expand on any of those if anyone would like, or we can wait till the end. There was one other document that I wanted to reference in the appeal, and that's page 242 to 244 of the document. This document illustrates the inherent challenges in regard to funding CRS services currently in Pennsylvania. This is one of the reasons that we felt opioid settlement funds were an appropriate fit for this project, is because it is extremely challenging to find funding that allows these positions to be sustainable in a variety of environments, one of which is residential levels of care, which is the levels of care that we're speaking of, 3.5 and 3.7. We have data regarding this facility in particular, the OUD rates of the clientele and the SUD co-occurring rates of the clientele here in this facility. They're very high, extremely high. I guess I'd like to, at this point, just address what the concerns were and reiterate and open up for discussion what the concerns were when we got our non-compliant determination. The trust, in my understanding, denied this request because there was an appearance that it was supplanting staffing costs that might have been available through various other funding streams. We do work very closely with our managed care organization, CCBH, to identify potential funding streams. And I do acknowledge that there's inherent complexities when you speak specifically regarding certified recovery specialists in the DNA field. It's a very complex, convoluted funding arrangement, but this is not atypical of other arrangements that I've seen and that I'm aware of in other counties across the state in regards to utilization of other funding to support the sustainability of this critical service. And that's really where we determine opioid settlement funds could be best utilized, is to support positions that we could not fund, strategies, initiatives, programs that we could not fund using traditional means. And we feel like this fit pretty squarely into that mission.
Yeah, these are new staff then, correct? Just to be clear.
Absolutely, sir. Yes. In addition to that, we required OUD specific training for these staff, co-occurring trainings for these staff that were in addition above and beyond what the normal facility training requirements would be for a CRS level staff. So we required additional training and expertise and knowledge for these staff that were using opioid settlement funds to pay for training that was not present before or would not be mandated were it not for utilizing opioid settlement funds. We felt like specialized training in opioid use disorder, medication assisted treatment, overdose trends, co-occurring disorders was extremely important and vital for this level of staffing. And so we required that when we established the contracts for these services.
Maybe it's somewhere in here. Can you speak to the demand? If we have 2 new staff, I know that community-wide, you've already discussed the problems that we have. What about the clients or the patients or the people that actually have a demand for this? Did you see these staff addressing that increased demand? Or let me ask this way, has there been an increased demand because of the staff?
Absolutely. An increased demand in certified recovery specialist services? Absolutely. And that's really part of our initiative. When you talk about the drug and alcohol continuum, and you talk about keeping people connected who are at risk of being disconnected, certified recovery specialists are essential. They're critical. So we are talking about a residential level of care. There's some nuances there in regards to funding, per diem placements, right? It's convoluted, it's complex. But in my mind, we lose people often, sir, in the transitions between levels of care. And that's really what this project is meant to enhance. So people being discharged from residential care, there's often a delay in additional service acquisition. And this was meant, that 6-month follow-up post-discharge, this was meant to alleviate that huge deficit that we see. So somebody leaving residential care, could they, yes, go seek CRS services elsewhere? Absolutely. And they still have that right. But what this allowed us to do is to have persons inside this residential level of care, 3.5, 3.7, to advise on treatment plans, to revise our recovery plans, to build rapport with these individuals. So there's no loss in how they transition out of that level of care into the next level of care, whether it be seeking medication assisted treatment modalities, counseling, whatever it is. We provided that 6-month window that was established, the rapport was established while they were inpatient. And we just felt like that was critical and currently lacking in the continuum. And that's really what this is about, is enhancing those certified recovery specialist services and providing that warm handoff, for lack of a better term. We're not talking about traditional warm handoff, but just providing that wraparound care as they leave that level of care and they need to find housing, and they need to find an outpatient clinic, and they need to find a counselor, and they need to find a clinic that provides their MAT. Providing that certified recovery specialist with that pre-established rapport is absolutely critical in my mind.
Kevin Boozle again from Butler. You'd mentioned per diem. I'm assuming that's like a VA per diem. Is that where that per diem's coming from?
So I was referencing the per diem structured rates for residential levels of care.
Okay, all right. So that was and then are these transition plans and other services built into that regional recovery hub as part of the programming? Was it already there? Are we duplicating a service? I understand the transitioning the gap. I get that part, and I get the sort of we're doing something similar with coming out of jails, similar handoff, carrying them through. So I understand that piece of it, but you're mentioning. My question is, how much is the CRS doing inside of a program that's already funded?
They do. There is a high level of engagement and enhancement in regards to helping the client build their recovery plan. So there is engagement, there is activities while they're in residential, and then throughout that 6-month window post discharge. This was not done before we had the opportunity to use opioid settlement funds. And to be honest, to be frank, it's probably one of my huge deficits as a human being. But if we were not allowed to utilize opioid settlement funds, we currently do not have the funding available to provide for these services. So we would be looking at losing these services. Is there other avenues of funding that we have available or we could allocate to CRS services? Yes, there is. But currently we don't have those funds in our budget due to many factors, one of them being Medicaid unwinding this last year. We are currently running a deficit. We do not have the funds to pay for these CRS services if we cannot use opioid settlement funds. And I guess that's really the point that I can't overstate and overemphasize is that were it not for the opportunity that the opioid settlement funds provided, we would not be able to do this enhanced CRS project at this facility. And I feel like that would be a huge detriment in regards to what recovery looks like for these individuals as they step down through those levels of care, right? I don't know if that answered your question, sir.
It did. Thank you.
I have a question. The 150,000, is this a one-time payment? You said you don't have money in the county to do this, so once the 150,000 runs out, you would no longer have the means, I guess, to keep those 2 individuals on staff?
That is a great question, Senator. Currently, our plan would be to run this program ongoingly using opioid settlement funds until we were able to identify another funding mechanism that we could utilize. And I have no doubt that we can do that. We just can't do that right now. And one of the reasons being unwinding hit the SCAs. I know Shay, you can speak to this, but hit Erie County particularly hard. We're running a $300,000 or $400,000 deficit currently. We do not have the funds available right now to fund this with any other our traditional funding mechanisms. Could that look different down the road, a year from now, 18 months from now? I anticipate it will, but I can't provide you with an assurance or a date on when that might materialize. And I hope that answered your question.
It did.
Scott, whose employees are the 2 certified recovery specialists?
Cadencia, sir.
They are employees of them.
Yes, sir.
And do they treat other kind of addictions other than opioid, such as gambling, such as alcohol?
So gambling wouldn't be a primary factor in that level of care, in that residential 3.5, 3.7. They are not exclusively opioid use disorder clients. If that's your question, I did provide data on that. Over the last couple of years, I believe that number hovered about 50%. In addition to that, we were up to 87% ish at the 3.7 level of care in that facility based on claims information. And that's utilizing base and CCBH data. We're up to 87% for co-occurring issues. So you talk about primary, secondary, tertiary causal factors for that level of care. OUD primary being approximately 50%. Co-occurring SUD, mental health, behavioral health issues being upwards of 87%. So when we talk about providing a continuum in the drug and alcohol, today in the drug and alcohol system as it currently exists, unfortunately, we have a very high percentage of clientele that have co-occurring issues. And it's very challenging to come up with a specific percentage or number in regards to what percentage of that number specifically is related to opioid use disorder. And it makes it even more challenging when you start to understand that most of the illicit drugs that we're seeing across the state, and specifically in Erie County, have fentanyl. They have synthetic opioids in them. Many of our clients, so based on WHO data, warm handoff data from our hospitals, traditional warm handoff data, don't even realize that they're addicted to fentanyl. They are in the hospital because of an overdose from a drug that they acquired on the street, where they thought it was cocaine, or they thought it was a methamphetamine, or they thought it was heroin, or they don't know what they're taking. So unfortunately, what happens on the ground is you have a bunch of clients that are addicted to opioids, particularly fentanyl, at upwards of 90% here in Erie County, and don't even realize that they're addicted to fentanyl. I hope that answered your question, sir. I know that became very convoluted.
It did, but what I took from it was there's no requirement that they treat just the opioid addiction. It could be cocaine, it could be alcohol, etc., because certified recovery specialists don't specialize in just one or the other. They can deal with various kind of addictions. Is that correct?
Absolutely. And that's really, I definitely understand your point and your perspective on that, sir. And that's really where we required additional and enhanced training for these individuals so they can focus on opioid use disorders, medication assisted treatment options and modalities, where currently they were not afforded those training and knowledge opportunities. So we mandated that. So yes, will they interface with persons not addicted to opioids? Absolutely. But they do have that skill and knowledge and ability to focus on those clients that have opioid use disorder and who are at risk for opioid use disorder and overdose. And I absolutely believe that this program saves lives, because it is in the transitions where we lose people. So they step out of residential, much like we see in the prison systems. They step out of incarceration and they don't have those wraparound services. They don't have an individual that they know, that they're familiar with, to contact. They start making phone calls. And then they end up eventually getting to the treatment and the care that they need. This provides that as they leave the door, that provides that point, that human contact that is so often missing and cannot be overstated as far as how critical that is.
I did Google the not-for-profit that is the employer of the individuals that you're paying for. And I did see that they take most forms of insurance. They take Medicare, they take most commercial insurances, et cetera, et cetera. Is there anything that precludes the not-for-profit utilizing the employees that you're paying for and charging an insurance company or Medicare for the same for the services that are being provided?
I mean,
I'm sorry, Scott, I just want to make sure we're understanding the question. Are you saying that they would be billing their insurance as well as billing these trust funds?
I don't know if they're billing the insurance. The way I took the submission, at least the original submission, was that you were paying for the certified recovery specialist and putting them in the facility for the not-for-profit that is employing them. Is that correct?
I'm sorry, I didn't understand the question, Mr. Van Kirk. I'm sorry. Can you please repeat
The
that?
question is, what are you paying? Are you paying the salaries of the certified recovery specialist?
Yes.
Okay. So, and you're paying the salaries, but the not-for-profit is considered to be the employer. Is that correct?
Yes.
Okay.
It's a cost
And
reimbursed contract where they bill us for the salaries for these individuals, yes.
now my question is, to the extent their employee might perform a service, deal with a patient, are they charging, if that individual is fortunate enough to have insurance, whether Aetna, United, or whatever, or fortunate enough to have Medicaid that pays for it, are they being charged? Is that insurance company or Medicaid, excuse me, being charged for the services?
No, that would not occur. It's a convoluted process when you talk about residential rate setting procedures. So XYZ processes, Shay, I know you're familiar with these. Those costs would not be allocated in those rate setting equations, right? So they would not be able to do that. They would not be able to charge another SCA for those services. They would not be able to charge Medicaid or another private insurance organization for those services individually.
So in other words, let's say your charges are, I don't know, $100. Medicaid is reimbursing 65 of that. Are we paying for the other 35 to meet the 100% of the charges?
No.
Okay.
And
As a 501c3, that you're contracted with are obligated to take everybody, regardless of ability to pay, of course. And through the insurances, you're going to be, or they are going to be charging off whatever the contract says with that particular payer. And then there's going to be, again, a gap, but you accept the charges, you accept the payment 100%, or they accept the payment 100%. They're not looking to get paid extra to meet that total charge. I mean, I know a little bit about how hospitals bill. Okay.
Correct. Yeah.
So, all right, thank you.
Absolutely.
Now, I'm sorry, Scott, because you're probably being very clear and I'm just not understanding it, but you're paying for the certified recovery specialist, but they are coming in and being admitted through the not-for-profit facility. Is that correct?
Yes.
And if they have insurance and present that insurance, are we sure that the not-for-profit is not charging that insurance company for the services?
Yeah, so CCBH, we coordinate very closely with CCBH, our managed care organization here, behavioral health, mental health. CCBH, we meet weekly, and they have mechanisms in place. So when you talk about client populations and residential drug and alcohol levels of care here in Erie County, you're talking about over 80% would be Medicaid funded. 10 to 12 to 14% would be funded by SCA, meaning persons not eligible for Medicaid and that do not have private insurance. And then you'd be talking about a very, very low percentage of individuals that have private insurance. And those are just historic numbers, sir. Those aren't hard numbers, but that's what we're seeing currently here in Erie County and over the last couple of years.
But there's nothing to preclude. For example, if I have United Insurance and my grandson is on that insurance and is somebody that is a beneficiary of my insurance, there is nothing that precludes the not-for-profit, if he would go in and be treated by one of these certified recovery specialists, from that insurance company being charged for the service.
There are laws to prevent that. Yeah. So the XYZ process really illustrates how that unfolds from an SCA perspective, but the processes are mirrored across different insurance agencies, right? So CCBH has a similar process. So on the SCA, we have a rate setting process called the XYZ process with residential providers here in Pennsylvania, and they create a budget based on the services they provide. Often those services align with the mandates and the regulations that allow them to be licensed for that level of care, and they list out those costs. So the cost for these certified recovery specialists would not be in that equation. That equation is taken, divided by the average clientele that they've had over the last year, and you get a number. So for residential 3.5, it might be $350 a day. Being a nonprofit, they meet the requirements of their budget based on expenses versus cost, and that's really all it is.
Okay,
So those would not be, these certified recovery specialists would not be part of that equation. It would not raise the per diem rates in the facility that we're speaking about, if that makes sense.
no, it does make sense. And by the way, just so you know, regardless of where this appeal comes out, because of the particular thing of you're paying for a not-for-profit's employees, that the salary is being paid by you, I don't want you to take whatever, this is Tom Van Kirk speaking, not speaking on behalf of the trust. I fully encourage opioid money being spent. If the county wants to spend money on training programs for certified recovery specialists, to train more and more so you have an abundance of certified recovery specialists, I have no trouble with the training of it. It's whether or not we agree that the proper use of opioid money is to actually pay for that person to be placed in a private employment, okay?
And that I appreciate that. That brings up another pertinent topic. Is one of the requirements that we contractually obligated this facility to adhere to is for the CRS recovery specialists that we do pay the salaries for to be actively involved in the regional recovery hub project here in Erie. So what that means is they are mandated to be actively involved in that project, in that process. So that means at least monthly meetings, discussions, public facing forums, a situation arrangement that would not be available if we were not to use opioid settlement funds. So we've required them to be actively engaged in that recovery hub moving forward. And what that really does, in my mind, is allow us to really drive the narrative on what recovery looks like here in Erie County. What is appropriate recovery? Because that has been distorted across the state very recently. That allows us to have that active engagement as a requirement of that contract to say, look, they will meet with us monthly and will be part of the decision-making process and the determinations on what proper recovery looks like. And that was missing, and it would be missing if we weren't able to have this funded using opioid settlement funds currently.
Thank you.
Yeah, and that really helps us inform, educate that staffing population on what best practice really is, because it's a little confusing currently in Pennsylvania, depending on who you talk to. But it allows us to really drive that narrative on what does recovery, what does effective, efficient, best practice recovery look like. And the CRS are critical to instituting that, to implementing that narrative and that design.
Thank you.
Absolutely.
Are there other questions? We are approaching the end of 30 minutes.
I have nothing.
I have nothing.
Me neither, I'm good.
Okay, hearing none. Look, I really appreciate your taking the time to present this. I didn't when I was in the middle of reading all 300 pages of your submission, but I do appreciate the thoroughness with which you submitted it. And once again, I really do compliment you on the procedure you set up and the way you set it up to get input from a number of different people across the county, Scott. So once again, regardless of how the appeal comes out, I hope you can take a great deal of solace that more than $1 million of your projects have been approved. Okay, so it shows you're doing something right.
Thank you. I appreciate that, sir.
Okay. Bree, with that, I would ask the Erie people, you can still participate in the meeting, but you can still be on the public meeting, but you'll no longer be able to speak or participate actively. And I will ask the Chester County people to get on and identify yourself so we can go on with the Chester County appeal.
Good afternoon. My name is Kelsey Gavazdich. I'm the Assistant Solicitor with Chester County, and I'm going to allow the individuals with me to introduce themselves as well.
Good morning, or good afternoon. I'm Pat Bakovitz. I'm the Human Services Director here in Chester County. Thanks for your time today.
Good afternoon, Rachel Kramer. I'm the Opioid Settlement Coordinator for Chester County. Thank you so much.
Good afternoon, Jamie Johnson, Director for Chester County Department of Drug and Alcohol Services.
Great.
If I may, we are here today on Chester County's Equestrian Recovery Supports Program. This is under Exhibit E, subsection B5, to provide community support services, including social and legal services, to assist in deinstitutionalizing persons with OUD and any co-occurring SUD or mental health conditions. The stated reason for the non-compliance was that the information provided by the county did not establish any connection between the program and those with OUD and those at risk of developing OUD. So to back up into the explanation of what this program is, it is our partnership with Gateway Horseworks. We started with this program in August of 2023. Our initial cohort ended in December of 2023, and there are 4 to 6 participants per cohort, and a new cohort of participants starts every 6 weeks in this program. It involves clients that are very early in their recovery, and its aim is to help their retention in treatment and recovery and to reduce the rate of clients leaving against medical advice. Every week, the program meets for 90 minutes. It meets at Gateway Horseworks Farm. And at each session, there is a mental health professional and an equine specialist who is there to help with the horses and with safety, of course. So this is a form of equine assisted therapy. There are different types of equine assisted therapy, as y'all may be aware. One model engages clients in riding, and then the model relevant here is known as equine assisted growth and learning association model, also referred to as the EGALA model. This doesn't involve riding horses, but rather engaging the horses in treatment. This model has been around for a very long time. It was founded in 1999, and currently there are 700 active programs following this model worldwide. It's recognized by the American Psychological Association, the American Counselors Association, and also the National Association of Alcoholism and Drug Abuse Counselors. And it is the most widely known and respected equine assisted psychotherapeutic model. And it offers a fully developed and it's a professionally endorsed evidence-based treatment model. I know, though, as many of you it may be confusing, if you're not riding the horses, what are you doing with the horses, and how are these horses engaging in therapy? So like I said, this involves clients who are very early in the recovery who, may not be ready to talk. Or they may need a different way to express what they're feeling, what's going on with them. So if anybody watched, and it was linked in the documents we submitted, the documentary that was done about this, it's about 30 minutes. But it depicts, they start with a group exercise where photographs of wild horses are laid out, and they're asked clients to select 2 pictures, one representing where they're at now and one representing where they hope to be. And then they have a group discussion discussing, why did you choose this picture? What does this represent for you? And it's a tool to get people talking, to express this. And they also discuss then, okay, what has to happen in the in-between of the where we're at now and where we want to be to get there. And then the other portion of this is they go into the pasture with the horses, and they're invited to help the horses return home to a shed several acres away. And clients have shared how the horses needed more time because they needed to build trust first. So then that is a discussion point of, how does trust need to be built with your family due to your addiction? So it's very working in metaphors, things like, how did it make you feel when the horse walked away from you? How does that relate to how your family and friends have walked away from you during this time? The horse is wearing a halter. What is your halter in life? Like I said, though, there's always a professional certified counselor there, as well as the equine specialist. And Chester County Department of Drug and Alcohol was actually referred to Gateway Horseworks by our children and youth program and our prison, based on both of their successful partnerships and implementation of programs with Gateway Horseworks. One of the reasons stated for the non-compliance was that the information provided didn't establish a connection between the program and those with OUD and those at risk of developing OUD. And at the time when we initially submitted to the trust in May of 2024, our clarification, we didn't have the statistics for the rate of substance use disorders to OUD. However, we now have that data, and 55% of individuals with substance use disorder had co-occurring OUD during that reporting period.
Sorry, the number was 55%, did you say?
55%, yes, sir.
Thank you.
And so you may be wondering, well, why can't it be 100% with OUD? Why can't we focus in on that? And it's somewhat as my colleague from Erie County made, it is not our practice in Chester County Department of Drug and Alcohol Service to further stigmatize clients by funding their treatment based off of their primary substance of choice. And it's also impractical to separate out these clients. As the gentleman from Erie County said, some individuals don't know they have a fentanyl use disorder. And many times we are seeing stimulants that are being cut with fentanyl. So somebody who is a substance use disorder may as well have also an opioid use disorder, or they're very at risk of developing an opioid use disorder, which is one of the stated reasons as well. And also recovery is not always a linear path. More often than not, it's not a linear path. It's not that, once a non-opioid user, always a non-opioid user. Because again, the client who's using stimulants may evolve into a client using opioids. And that is something we are trying to address with this program. Another point too, Chester County actually presented on our partnership with Gateway Horseworks in the development of our Stable Pathways program, which is our program with Chester County that we have at Chester County Prison, where a pasture was actually built on the prison grounds for this program. And we presented on that in a poster session with the County Commissioners Association. A lot of those in attendance had expressed interest in this. And this program now that we're doing with our drug and alcohol is directly a result of that and the successes of those programs. We're also aware of, and we've, similar programs for equestrian services being offered in Berks County that had previously been approved by the trust. And we looked into that program, and both of the programs, both the Berks County program and Gateway Horseworks, use horses to help treat clients with OUD. And we thought, and the trust has, through the approval of the Berks County program, expressed a belief that equine services are a valid and worthy treatment for those with opioid use disorders. We also have had success for people in these programs. According to the U.S. Department of Justice 2018 report, roughly 68% of released prisoners are rearrested within 3 years, and 79% are rearrested within 6 years, and then 83% within 9. Participants who completed Gateway's reentry program had a rearrest rate of only 8% after 5 years. In terms of those in the program for their opioid use disorder, that was our success related to our prison program. Clients from an inpatient recovery center who attended sessions at Gateway remained in treatment 49% longer than those who did not. And they also completed 4 full courses of treatment at 3 times the rate of those who did not. So we feel that this is a worthy program for settlement funds, as we've seen success with it. It is targeted at those with opioid use disorders or those who are highly at risk of developing an opioid use disorder. And for those reasons, we feel that it does appropriately fall under Exhibit E, subsection B5. So now I'd ask if any of the trust members have any questions for myself or any of the experts that are sitting here with me.
Yeah, Kelsey, I'd like to just make sure that we're all on the same page. How much money is committed to this program? The information I have, we're talking about $15,000, but I don't know if that was just what was spent as of March 15, or if that's even the correct number. So what is the amount of money that is in dispute, that you're disputing with us right now?
Yes, yes, sir. The amount of money was, as you said, I had a little over, it was $14,074 was the amount, so a little under 15,000. But that was, and I can clarify with my colleague here, up to a certain point.
So that was the amount that we had spent as of the reporting period. So as of December 31st of 2023. And because this program was denied or deemed non-compliant, we didn't submit that on this current reporting period. Those programs deemed non-compliant were actually removed from our reporting form.
I have just a couple of questions. This is Rob Postel. Thank you for those metrics that you said about the recidivism. I was going to ask that. How are the clients chosen? How are they recommended or referred? I suppose that's one question. And the other question, since you don't take insurance, I'm wondering how many sessions or how many clients are. I think you said 8 per session, but how many sessions through the year does that $15,000 covering? But first on the referrals, how do people get to you?
So the clients were selected on one program in particular. We piloted this with the recovery house in Phoenixville. So anybody that was newer to the recovery house and did not have full-time employment yet would have been referred into the program.
Is there over demand? It doesn't seem like it's. Are there more people being referred than places? If you only have 8 per session.
Well, it's every 6 weeks. So they complete the course in 6 weeks, and then a new set of individuals go into the program.
Okay. Okay, and can you just speak to the how many individuals do we have? I'm not sure I saw that anywhere through the program.
Well, so there's about 6 individuals per group, and it can vary. It could be as low as 4, maybe as high as 8. 8 would be on the higher side, but typically it's around 6.
Okay, but if you take in 2024, how many do you think are going to go through the program? Or 2023? I'm trying to figure out what the size of it is and the cost, which doesn't seem all that much.
Yeah, I'd have to do the math on that. Give me a few minutes and I'll get back to you.
This is Kevin Boozle, Butler County Commissioner, and I have a couple of questions as well. So you said upon the denial that the program was already in operation, correct?
Yes.
What happened at that point once it was denied? Did it subside? Did it stop? And if not, how are you funding?
We did not stop the program. We had to find other funds for that piece of the program. Because of our county close, we actually did have to find other monies to support the program. We are concerned and ambivalent that we may not be able to continue with this program going forward if it's not supported with opioid settlement dollars. It's not a program we would typically fund with other dollars because we don't really have the other dollars to continuously fund the program.
And I heard you hit on some keys, talking points, which is evidence-based. I read through that. I know I think it was Casey that spoke about that. You know, and I think that's very important. I also look at expansion of programs, but you hit something very succinct, which is the 55% SUD co-occurring. And I understand you're concerned about the stigma of separating. Just like any other funds, though, that is part of the requirement to meet a benchmark of service. And I hear what you're saying about at risk. Can somebody explain to me how you identify an at-risk OUD as opposed to a non-at-risk OUD? Because not everybody is OUD at risk, regardless if I'm an alcoholic, Gamblers Anonymous. How do you define that, and how do you benchmark that? How do you measure that?
So we would define anybody at risk who is in recovery would be at risk, one, of a reoccurrence, and not necessarily based on their drug of choice. And I think Scott from Erie hit on it best. Was we have folks using stimulants to include cocaine, and we know that they're cut with fentanyl. Not only are they cut with fentanyl, but there have been fatalities related to using other substances. So although I may identify with somebody with opiate use disorder, quite honestly, people with stimulant use disorders are also at extremely high risk of fatalities because of what their substance is cut with. And when you look at the younger population, the youth in particular, the first time user of a substance such as meth or cocaine, they too are at high risk because, again, the substance is cut. You don't really know that it's cut with fentanyl. So we really deem them at high risk as well. And then how's it measured? We measure it by how many folks attend the course over the 6 weeks, and then the outcomes. So going back to Mr. Postal's question of how many clients would that be a year, it would be anywhere from 52 to 69 clients per year.
Thank you.
And then going back to my question of referrals, then it's not really, it's not specific to OUD clients. It's the referrals are coming from perhaps the residential institution or counselors, but it is not specific. You take all comers as long as they meet the general criteria.
Correct.
Okay.
Other questions?
I have nothing else, Mr. Chairman.
Thank you. Anybody else?
Chairman, Commissioner Postal asked most of the questions I wanted, in particular about participants. So thank you, Commissioner.
I have one additional question just for my own sake. If it wasn't for the opioid use disorder funding from the trust, is this an allowable expense under other funding that under drug and alcohol funds that you get currently from the state? Would they fund this program?
I believe they would, yes.
And you base that on what? I heard evidence-based, but is there any other reason that you believe that?
Well, not only is it evidence-based, but you're also helping an individual in their own recovery pathway. So you're helping somebody sustain longer-term recovery and engage in recovery, and you're reducing the AMA. So over the long run, you're certainly reducing the amount of money that you would have spent on that individual in terms of they're not going from one program to another, or they're not having a reoccurrence or a relapse. So you're keeping them engaged longer, and we know longer lengths of stay in treatment supports long-term recovery. And just going back to Mr. Postal's question around funds, if I can draw a comparison, so we have $14,000 spent on Gateway, but when you look at one residential treatment alone on SUD dollars, so that's the county paying for it, it could be anywhere from $5,000 to $20,000 for one treatment episode. So when you look at the comparison of funding and the fact that we are potentially funding anywhere from 52 to 69 clients on $14,000, maybe a little more over the course of a year. For us, that would be considered as not only a significant investment, but a wise investment when you look at the cost of residential services throughout the state of Pennsylvania.
Yeah, I have another question though, because it occurs to me. I think we talked about the sustainability, but where do you get the contributions and donations? If you didn't get this money, which to me doesn't sound like all that much, you said you had to close the program or you wouldn't be able to continue the program?
We would not be able to support this part of the program. So it's a program that exists with or without us because they work with other entities to include Chester County Prison, Chester County Children and Youth, as well as juvenile probation. So they have other participants participating in the program. We have a time slot weekly that is earmarked for Chester County Department of Drug and Alcohol Services. So
Okay,
I would suspect that they would fill that time slot with another entity.
okay. Yeah, that clears it up. Thank you. So I've seen your annual report or the annual report, I don't know if it's yours. And so there's, I'm going by memory, so help me out. There are other contributors and donors, and I think your budget's something like, or their budget's something like 300,000 or 350,000. So I was just wondering where the rest of that money is coming from. But I understand that there's a time slot now from drug and alcohol, and that's what this is paying for.
Correct.
Okay.
Okay. Other questions? Okay, hearing none, is there anything else that Chester County would like to add before we move on to Dauphin? You have a couple minutes left if you would like to avail yourself of it.
I don't believe we have anything further, and we thank the trust for your time here today, though.
Well, thank you for a very thorough presentation. We appreciate and the documents that you did submit. Thank you very much.
Thank you.
Thank you.
Okay, we'll now move on to Dauphin. I'd ask the people from Chester, they can stay on the phone, but will not be able to speak or participate. And we will move on to the final appeal that we're hearing today, which is Dauphin County, if you would, please. If you would identify, if the people from Dauphin would please identify yourself and introduce yourself. And the program is the Renew project that is being considered.
Thank you so much. My name is Randy Yeager. I'm the Human Services Director for Dauphin County. With me today, I have Commissioner George Hartwick. I have Jess Kammerer, who is our consultant. I have Natalie Burston, who's one of our assistant solicitors. Kristen Varner, who is our Drug and Alcohol Director. And Heather Quick, who is my Human Services Fiscal Director. Thank you so much for your time this afternoon.
Okay.
So the program we want to share additional information about is the Renew program. And in Dauphin County, we have an integrated approach to services and supports, and that's really to ensure that comprehensive systems of care. The Renew program is a holistic, intensive case management program serving polysubstance users who are pregnant or who are parenting. And this is a program under the larger umbrella of Bethany Children's Services, which is a nonprofit 501c3. The Renew program has a solid foundation for successful recovery services, and they really start that process by building trusting relationships and needed connections to support individuals with complex needs who are also parenting. We chose to fund this program really based on our local data. The following is some of our local data, which identifies some of the complexities of the parents, specifically the women and children we serve. In Dauphin County, we maintain data from our Children and Youth Department related to safe plans of care. So this data is actually sharing with us every drug-exposed infant that is born in Dauphin County. And to date, and this data goes back to January 15th of 2020, up through June 12th of 2024, we had 643 babies born in Dauphin County, and 12% of those infants tested positive for opioids. Any illicit substance use places individuals at high risk of overdose and overdose death. As another data element, last fall, actually September 9th and 10th of 2023, Dauphin County Emergency Management was in contact with myself and some of my colleagues on this call because we had 22 confirmed overdoses in a 72-hour period. The situation on that particular period of time, those individuals' drug of choice was actually cocaine, crack cocaine, and marijuana, all of which were laced with fentanyl. And so even though our women are reporting specific substances, we, like many of my colleagues across the state, are seeing various types of illicit substances laced with fentanyl. Any history of substance use disorder and mental health concerns, we believe, puts individuals at a heightened risk of developing opioid use disorder in the future. And due to the supportive services by the Renew program, the participants are mitigating that risk. Our initial participants in this program all had substance use disorder and mental health concerns. And I believe that was one of the concerns of the trust. That initial reporting period, we had marijuana users and PCP users who were participating through December of 2023. At this point, I want to share some additional data from January through June 30th of 2024. So we've had 2 referrals from Pennsylvania Psychiatric Institute, 6 referrals from our UPMC Hospital Social Work Department, 5 referrals from Dauphin County Prison, 1 referral from Dauphin County Adult Probation, 1 referral from an inpatient treatment program called Gedenzia Vantage. And then we had an additional person who came to the Renew program in Dauphin County, but did not only because they moved into the area. So of our current participants, we have 15 referrals, 10 of which have completed the intake and are actively engaged in this intensive case management service, and 5 of those remain in the referral process. So currently, 5 of our 15 have reported opioid use. 5 of 15 also reported cocaine use. 1 of 15 reported using bath salts. 6 reported using a variety of hallucinogens, including PCP and Molly. 6 reported marijuana use. 3 reported crystal meth use. 4 reported alcohol use. And 10, as you can tell by that data, are polysubstance users. In terms of vulnerability, we are very concerned about our customers exiting incarceration. 5 out of the 10 of these individuals in our program are persons who've exited incarceration. 8 out of 10 were homeless, and 6 out of 10 had co-occurring use disorder with opioid substance use disorder, as well as mental health concerns. I certainly will defer to my colleagues if they would like to add any items, just because I had the privilege, and I thank you for allowing us to participate when my counterparts across the state had testified. So total spent to date is $44,699.39 to serve both the 10 current participants and also the 5 additional women who are in the intake process. And we're certainly happy to answer any questions of us.
Of the approximate $44,000, what did it go to? In looking at your entire submission, I got a little bit confused. Is this what you're doing is paying the salary of a particular administrator? I'm calling it administrator. I recognize it's more sophisticated, believe me, than that. But you are paying the salary of a person who is employed by Renew. Is that correct?
That is correct. And they call themselves women's advocates, and they do that purposely because what we have found is the women they're engaging with are more apt to connect with them if they like to say, we're just women who want to help other women. So calling them a women's advocate has really helped engage folks in those initial building trust and relationships.
Okay, does Renew itself provide any services other than referring to a hospital system or a facility that actually treats either the woman or the newborn?
Yeah, so the Renew program is pretty holistic in that respect. Whatever that person's needs are, they make sure that they're connected with those services. So it may be medication assisted treatment. It may be a housing opportunity. I know that our women's advocate literally helped move somebody into an apartment, carrying couches upstairs. Oftentimes these women who have, have concerning relationships, they don't always have somebody to help them out in any aspect of their life. And that's really what Women Helping Women is all about.
Okay. And one final question from me before I turn it over to others, if you don't mind. But and if you know, and this is a little bit a matter of curiosity, would it be Renew or would it be a treatment center that would enter the fact that a child was born who had tested positive for opioids, that would enter it into their electronic medical records so that when they become 15, for example, and are injured in a soccer game, or when they turn 15 and have a molar eliminated, that their records would show that they were born addicted to a substance, and therefore, hopefully, the person treating them when they're 15 would be aware of the fact that they are going to become more easily addicted if they are treated in the wrong way.
So that data that I shared with you is actually data directly from hospital referrals. It's not just one hospital, it's every hospital is reporting those data elements as part of our safe plans of care. So the data comes into our children and youth office. So the hospital system maintains that data.
Okay. So that is not part of this particular program,
No.
but it is something you are aware of. Yes.
Yeah, when we make decisions, we really like to ensure that the reason behind the decisions we're making, not just in substance use disorder, opioid use disorder, but in all of our decisions, that it's driven by data. And so that is one element that we took a look at before our panel made recommendations to our Board of Commissioners for funding.
Thank you.
Thank you.
And this is Commissioner Postal. At first I didn't like that label, women's advocate, but I do. I think that's smart. I got the impression that it is, I don't know, an advocate for women, right? And but I know that's not correct. So I think that's a good label. In your budget, I'm going by memory, there was most of this is for personnel, as the chairman had asked. There's also client assistance. It was a relatively small portion of that. And it led me to a question of where is who else is participating in this? If you need to give out gas cards or diapers or whatever, where are you getting that money for those products?
So that depends on what is available. So the Renew Women's Advocate, her basic job is to remain connected with all other service systems in Dauphin County. So for example, for diapers, we have a diaper bank, and she would make sure that that customer, our client, is connected with that diaper bank. There are times where, whether it's the timing of the availability of the diaper bank, for example, that they may fund a particular urgent need with those monies, but that should be a relatively rare occurrence.
Okay, I found that it's $1,200 in the budget that is proposed, and I don't have a problem with that. All right, thank you.
Thank you.
Okay, other questions?
I have a very simple question. Sorry to be asking. I'm sure it's in here somewhere. Which part of Exhibit E is this falling under? Do you mind?
No, not at all. So in terms of Exhibit E, we actually think it fits a variety of places, but one of the items is providing those recovery services as part of this process. And in addition to that, you know, we make sure that if the women need connected with any other service, that they are the connectors, because they already are trusted. And so oftentimes when we have a trusted person serving our individuals, they're more apt to trust it. You know, I want you to meet these folks over here, and they can provide you with the appropriate levels of care needed. But certainly, I mean, the reason why, you know, this program is of a holistic nature is I also think that when we take care of the women who are taking care of their children, it's certainly a better trajectory when their parents are not using substances.
Yeah. Okay. So like maybe in area B, maybe 1 or 2. Anyway, in terms of which of the eligibility. And these folks they're not certified peers, and there's not any interest, if you will, in making them certified peers, at least not right now. It's part of the process.
Right, that's correct. And actually, they work very closely with our Hamilton Health Center Baby Love program. They work closely with our Penn State Hershey Medical Center. We have an obstetrician and gynecologist who also connects women. So it's really, our women seem to participate more because they are not professionals, if you will. Now, these are all bachelor's degree folks, but they refer to themselves as women's advocates.
Thank you.
How was it funded before, since?
Yeah, it was not funded previously. We used the opioid settlement dollars as an opportunity to really examine where we had gaps and what we could do that's different and new. And the Renew program is one of those programs that is brand new to Dauphin County.
Sieger, on that note, so since receiving the non-compliance directive from the trust, has the program continued? And if so, how are you planning to fund it?
It has not continued, and we have paused, if you will, funding any future programming for the current fiscal year that we're in now. And the reason we did that is we had asked Renew, based on the success that we were seeing, we had asked them to really solidify their partnerships with Hamilton Health Center as well as Penn State Hershey Medical Center OBGYN physicians. And that triad, if you will, is really what we were planning to present to our Board of Commissioners, but we have paused pending this appeal. Because depending on what happens there, then we'll have to make adjustments to our recommendation to our board.
Thank you.
Absolutely, thank you.
One additional follow-up question on the youth that are identified. Are they followed or tracked in any manner? Will they be eligible for additional funding long-term? I think of like, infants born underweight become eligible for certain funding, so on. Is this something that you're looking at or are you doing?
Yes, so all of the children who are being served via their mother, we make sure that they have access to early intervention programming if that has been deemed appropriate. We make sure that they can be enrolled in a Head Start program, or we're very grateful currently for the Catherine Hershey schools opening both childcare and early learning opportunities here in our county. So we make sure that those children are also connected. And again, that's done through the Women's Advocate. I do see Commissioner Hartwick has his hand raised, I believe. Commissioner, I'll turn it over to you.
George, do you have a question? I think you have to turn on your mic.
Can you hear me now?
Yes.
Sir.
Great, thank you. I appreciate the opportunity just to say a couple of words, and it's good to see you, Tom.
Good to
and
see you.
Obviously, all the members of the trust, Kevin and Commissioner Postal, both good to see you as always. The only question I wanted to follow up on is, what about sustainability of funding while we hit pause? I know I've had discussions about this particular proposal. We generally lack gender-specific initiatives around drug and alcohol generally. And quite frankly, the idea of bringing this into our needs-based budget process as we plan in the future, figuring out a way to look at identify TANF 4E as well as our block grant monies to be able to sustain this program is something I know we're committed to. And so we're not just looking to external monies to make this work. However, we didn't think it would be prudent to proceed without having some level of understanding on the findings from this committee. But it's something the county is going to be committing to doing with or without the appropriate level of support, and quite frankly, advocating for more gender-specific programming without those levels of barriers, both clinical barriers and the ability for us to be able to take care of families upstream versus just reacting to what goes on is something that we know is an investment that the county also needs to support, and we plan to do it again, regardless of the outcome of this hearing.
Thank you. Other questions? If I could just go back, just by way of follow-up, and because of something you submitted in your earlier submission, the question was asked whether the Renew project, whether the remediation program was in place prior to receiving opioid funding, and the answer supplied was yes, and that it began January 1 of 2019. I understood the answer to a prior question asked here was that the program was new and it had not been funded before. So I'm
Yes.
assuming that the original submission might have been an error.
No, the original submission was discussing that the Renew program started in other counties. It was not here in Dauphin County.
Thank you. Thank you.
Thank you for asking for that clarity. I appreciate it. And I certainly appreciate everybody's time this afternoon.
Okay, any other questions or anything else from Dauphin County? Okay, thank you all very much. What we're going to do now is to adjourn and go into executive session. I see it's about 1 o'clock. We will be in executive session for 15 minutes. Let's make it 20 minutes to give people a chance to to wander around a little bit if they'd like. So we will start the executive session now. We'll restart the public meeting at 1:20 and hopefully be taking votes at that time so we can keep everybody from being in suspense. Okay, thank you. So everybody's on? Okay. And we did hear in the executive session that Aaron has some time constraints, so we would like to get right into the voting. What I would ask is that we will go through each of the 4 programs that were presented. By the way, we noted and discussed in the executive session what good presentations everybody made, very informative, and we really appreciate everybody's input into it. We will get a motion and a second for each of the programs separately. We'll go right in the order in which we heard them, and then we will have whatever discussion on the motion, and then we will have a vote after the after any discussion. The first motion will be for dealing with the Erie County opioid use disorder library collections. I'd like to ask somebody for a resolution that the Dispute Resolution Committee hereby affirms the decision of the Board of Trustees that the Erie County OUD library collections is not compliant with Exhibit E. What that means is a yes vote to that motion, if it's presented, means that it stands. A no vote indicates we're reversing the decision, and the program will be deemed be deemed compliant. There is one thing that could come up, and a question was asked in the executive session. If part of it is permissible, but another part not, based upon the percentage that was really spent, the vote should be yes, that the program is not compliant with Exhibit E, but with a request that we have a further vote as to whether or not a further consideration could be given at a later time to whether or not part of it is permissible because, for example, 50% was spent on opioids and the other 50% were not linked to opioids. Jason, is that, can we proceed in that manner?
Sure.
Thank you. Okay, could I have a motion, please, that the Dispute Resolution Committee hereby affirms the decision of the Board of Trustees that Erie County Program Number 9, opioid use disorder library collections, is not compliant with Exhibit E. Could I have a motion to that effect?
So moved.
Okay, is there a second?
Second.
Okay, discussion on the motion.
I will vote just to affirm the trust commitment here that this is not fit for the reasons I think that came out during the discussion, that this is not an evidence-based or evidence-informed practice and was not really targeting, except in the most broad sense, those at risk.
And Aaron, I would note that in that regard, we might have to further discuss going forward on a going forward basis, what it really means to be evidence-based, et cetera. But you'll recall that that was a large part of the consideration in affirming the non-compliance of the Somerset program was the fact that it was not shown to be evidence-based. Okay, other discussion or questions? Okay, I'd like to call for a vote on the motion. All in favor, a yes vote supports the denial of the trust. So all those in favor of the motion, please vote aye.
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 Opposed?
Opposed.
Okay. Could we have a roll call, please? Bree, go right down through the list.
Tamara Alexander,
Opposed.
Commissioner Kevin Boozle,
Aye.
Aaron Dalton,
Aye.
Shay Madden,
Opposed.
Commissioner Robert Postal,
No.
Senator Christine Tartaglione,
Yes.
Okay, we have a tie vote. That brings into play my vote, and I vote yes. Okay, a motion on the second program that was presented. I would like to have a motion resolve the Dispute Resolution Committee of the Pennsylvania Opioid Trust hereby affirms the decision of the Board of Trustees that Erie County Program number 11, which is Certified Recovery Specialist Services, that it be be deemed not compliant with Exhibit E. So could I have a vote on that? Could I have a motion to that effect, please?
I'll move the motion.
Is there a second?
Second.
Okay, all in favor, please say aye.
Excuse me, is there discussion?
I'm sorry, discussion, please.
Thank you. The only discussion that I had was, I do believe that a portion of this may be eligible, and I would like to reconsider that at another time, once we get into the percentages and so on. But for this particular motion, I will say it is non-compliant at this time.
So you would vote yes, but it would be then with the notation that I'll bring it up to see if we want to have a further consideration of it for at least a portion of the program. Is that correct?
That is my my
Okay.
wish.
Okay, thank you. We will do so. Okay, other discussion or clarifications? Okay, all those in favor of the motion, please vote aye.
Aye.
I'm also gonna say aye with the same suggestion as Commissioner Boozle.
Aye.
Okay, opposed?
Oppose.
Opposed.
No.
Okay, so I have 3-3. Is that correct, Bree?
yes.
Okay, and I will vote aye in connection with Kevin's proposal, and we will reconsider and reopen it for, so it is being denied for now, but we will reconsider and Erie can resubmit so that we can have the, and I do think when we are considering it in that manner and reconsidering it, that we should do it before the entire trust. So we will do so, and it's denied for now, but with the permission to do it with respect to a given proportion of it. Okay, next one is Chester County Program number 14. And I would like to have a motion, please. Resolved that the Dispute Resolution Committee hereby affirms the decision of the Board of Trustees that Chester County Program number 14, Equestrian Recovery Supports, is not compliant with Exhibit E. Is there a motion to that effect?
So moved, Kevin.
Second?
Second, Postal.
Okay. Any discussion? Other than the discussion that we had during a very active session during the public meeting?
I think it's the same issue, that to me, it's allowable under Exhibit E. And the trust over time is gonna have to take care and educating counties around the percentages of funding that can be used for people with opioid use disorder and how tricky that's becoming.
Okay, Aaron, would you like then for if a person votes aye, so that we are affirming the trust, but have it up for reconsideration for the full trust to consider whether or not there's an applicable percentage and what exactly that means?
Yeah, it's the sorry, Tom. The only thing that I would suggest is it's strange in that I do think it's eligible. I mean, it's sort of eligible for the pieces that are OUD, right? And so, but sure, it can be affirming the trust. So a no with consideration for the percentage that's OUD.
Gotcha. Other discussion? Okay, all those in favor of the motion? Once again, a yes vote will mean that it is not compliant. But in accordance with that discussion, we will also go back to the entire trust to see if there's a portion of it that would be allowable. All those in favor, please say aye.
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 Aaron, did you?
That was an eye on me too. I'm sorry. I think I might have been muted.
Okay. Opposed?
Opposed.
Opposed.
So is it 4-2?
I
I have
believe,
4-2 vote aye, yes. So it is deemed to be non-compliant, but in fact, we will go back and have the entire trust discuss the entire matter as to whether or not a given percentage of that particular program and the expenditure of the $15,000 was appropriate. Okay, final question will be Dauphin County Program number 3, the Renew Project. The motion I would like to ask for is resolved that the Dispute Resolution Committee of the Pennsylvania Opioid Trust hereby affirms the decision of the Board of Trustees that Dauphin County Program number 3, Renew, is not compliant with Exhibit E. Is there a motion to that effect?
I'll move the motion.
Is there a second?
Second, it's Aaron Dalton.
Okay. Discussion of the motion. Any question as to the percentage that was devoted to it, as it was the case with the second and the third motions?
For me, this one goes, the threshold I think has been crossed in terms of the way the folks are being identified as seriously at risk, if not involved in opioid use disorder right now.
Okay, thank you.
That doesn't mean everyone else for sure, but.
And that would mean that you're voting no, is that correct? Thank you. Okay, other discussion of the program? Okay, all those in favor of the motion that it be deemed non-compliant, please say aye. Opposed?
No.
Opposed.
Okay, I have 6 votes no and no A. So in fact, we are voting no, and we're reversing the decision of the trust so that Dauphin County Program number 3 will be deemed to be in compliance. Okay, anything else to come before the meeting? I would remind everybody that we do have another meeting of the Dispute Resolution Committee on October the 3rd. We're going to be considering 2 Bucks County programs and program number 9 from Philadelphia, which I believe consists of 5 separate grants. So we will be dealing with those on October 3rd. We will post the notice of the meeting and the agenda. Is there anything further to come before the meeting? Hearing none, the meeting is adjourned. Look forward to talking with everybody on the 3rd of October. Thank you.
Thank you.
Thank you, Chairman.
Thank you.